Namaskar. I'm Dr. Chetan Mundada. I am Chief Pediatric Intensivist at KIMS Cuddes, Secunderabad, Minister Road. And first of all, very sorry there was some technical glitch in the going live. So today we'll be talking about shivers after the showers. So monsoon it brings many festivals in our country along with the rains, and since last few decades, it's been consistently noted to bring many diseases along infections consistently. And few of them are simple infections, and some can take a complicated turn in some individuals. Today we'll be discussing mainly seasonal viral infections, and the thrust will be on respiratory infections because those are the ones which are now troubling our children more, and also dengue, chikungunya, and water and foodborne infections, because this is a festival season now, and nobody wants to spend their festival being sick in the bed or in the hospital. So when it comes to viral fevers, we all basically call viral fever as general public will call viral fever as fever where you have flu-like illnesses, where you have fever which is high grade, there is body ache, there is some runny nose or a soreness on the throat, and so we generally refer to them as viral fevers. But there are various viral infections which occur in this monsoon and post-monsoon season. So first and foremost is flu and flu-like illnesses, and then we have mosquito-borne diseases where the mosquitoes carry the viruses, and then after the bite of the mosquito, the human beings get infected with the virus. So dengue virus is one mosquito-borne virus, along with chikungunya, which is a close cousin of its, and we do have Japanese encephalitis, which again is a can be a very fatal disease. And then we have water and foodborne diseases like hepatitis A, which causes jaundice with fever, and gastroenteritis. Various other viruses like enterovirus, rhinovirus, adenovirus, and norovirus. These viruses they cause a lot of viral diarrheas in especially in small babies and young infants, toddlers. So when do you suspect that this is flu? So it presents like any other febrile illness. So there is not one particular sign which tells us that this is a viral infection, and that's why when you go to your doctor, not every time they will commit that this is a viral infection. Sometimes they will feel that it's a bacterial infection. They may even start antibiotics, and many times they will say no, this is a viral infection. I'll just give you symptomatic supportive treatment. So it presents like any other febrile illness, especially in the initial period of the illness. But fever is usually very high grade, again, especially initially, and then it loses the steam. Runny nose, soreness of throat, cough, preference for liquids or no milk, especially in young infants who can't express that there is some soreness in the throat or throat pain. They'll, they'll simply stop taking solids, and they will prefer more liquid or more water or other or milk like things. Older kids they can express body aches, they can express headache and a feeling of exhaustion or weakness. They don't want to move from the bed, and young babies can also have abdominal symptoms in flu. Despite being a respiratory infection, they can have loose motions, vomitings, and crampy abdominal pain leading to a lot of crying. So family member or close contact who are having these kind of flu illnesses should prompt us to suspect that the child is also got the flu. So what are the warning signs when any child has these illnesses, viral fevers? So breathing difficulty, which is obvious for a lay person also, and bouts of cough, hurried breathing if the child is breathing really fast, and children who have comorbidities. Some kids can have, say, a heart disease or some lung disease or some kidney issues, and they're already on some long-term treatments on that. So these are the ones who are more vulnerable for complications of these viral infections. And all obese children, they basically they suffer from a chronic inflammatory condition, which is obesity. So they are more vulnerable for all the complications of these viral infections. Then when you have very red short eyes, generalized rashes over skin and lips, so that is something where you need to really consult the doctor urgently. Severe abdominal pain with loose stool and vomiting again denotes that there is something more, and it is not a simple trivial viral fever. So poor activity, poor oral intake, giddiness or dizziness or feeling very, very exhausted. So these are the signs where one should promptly take a medical advice from your doctor, from your pediatrician. So how do you tackle viral fevers? So you basically manage, because viral fever, most of the viral fevers, they don't have a particular antiviral medicine. At least flu has one medicine which, if you give it in 1 or 2 days of the onset of the fever, you can still have a little bit relief from the symptoms, and the complications may get prevented. But other illnesses, like I'm talking about influenza A and B type of viruses, but other viral illnesses, most of them, they don't have any particular antiviral medicines, just like the way we have for typhoid or for various bacterial pneumonias. We have various group of medications available which can kill that particular bacteria, but not in these viral fevers. So it becomes very important to manage their symptoms, like control the fever with antipyretics like paracetamol, and rarely when the fever is very high, you can use drugs like ibugesic, like brufen or ibuprofen, and mefenamic acid, but their use needs to be restricted. Their use needs to be only on the basis of your doctor's prescription. And manage cold and cough with simple cold and cough remedies which is prescribed by your doctor, and maintain good hydration. This is the single most important thing one can do when a child has got a febrile illness. And so maintain the hydration well. What do you mean by maintaining good hydration? Give plenty of liquids which comprises of salt, sugar and water. So it can be simple ORS solution which is readily available everywhere. So ORS powder solution is the one which we are talking of, and not the Tetra packs, which mostly are fruit juices and they are not actually recommended. So all the ORS powder solutions, then coconut water, buttermilk, lemon juice, soup. So basically, all homemade liquids which we consume, they can be given, because that will provide water, salt, and sugar, and that will maintain the hydration status. That keeps the child going, and within 2 to 4 days, the child's immune system itself starts controlling the virus, and the child gets better. So always watch for danger signs, which we saw in the last slide, and urgently consult a medical professional if you happen to see any of the danger sign, and follow the advices of your pediatrician. Home remedies, yes, they are very popular and they do work in many individuals. So simple home remedies, like say for a sore throat, having honey, let the child leak the honey with his finger, and you can, if the child is a little bit older child, you can also put some ginger juice drops, so that will relieve the soreness of the throat, that will soothe the throat mucosa which occurs after, and that irritant cough which occurs may sometimes get relieved in many children. So some people do use turmeric milk or turmeric and black pepper added milk, which also relieves the soreness in the throat. Steam inhalation does relieve the congestion in the nose, and it helps in drainage of all the nasal secretions which are pent up, and that relieves the child of persistent blocked nose feeling and coughing. So home remedies you can use, but ensure that just not don't totally rely on home remedies. You have to be wary of the danger signs, and if you happen to see any of these danger signs in your child, you have to ensure that you take care of, you take a consultation from a medical practitioner. So when it comes to prevention, because from childhood we basically keep hearing that prevention is better than cure, prevention is better than cure, and which is true, because once you get a disease or get a infection, it takes a toll on the child's overall health. There is a school, you have to, you know, skip the school for some time, and the child also suffers a lot. So prevention is always better. So in COVID era, when the COVID was at its peak, we all were practicing these, but now we are again slowly forgetting these things. So SMS is a simple, short form where you have to maintain the sanitization, maintain, wear mask when you are having viral respiratory infection like symptoms, or the family members are having viral respiratory infections, and social and physical distancing. So these were things which we used to practice very rigorously when we all got struck by the pandemic. But now we are slowly forgetting the lessons which the pandemic has taught us. So hand hygiene is the single most important thing. Kids especially, they will touch everywhere, and then they will touch their faces, their nose, their eyes, and the infection can get transmitted from that surface to their body, and they get infected. So always inculcate the habit of washing the hands with soap and water properly, thoroughly, in your child. When the child gets older, say after 2.5 to 3 years, they can do that. They just don't play with the water. They can actually wash their hands properly. Use alcohol based sanitizer only when soap and water is not available. But especially infants and young toddlers, you have to be very careful, because we have seen children getting alcohol toxicity or getting features of alcoholism just by consuming this, because it's a very highly concentrated, most of the sanitizers, they are highly concentrated alcohols to the tune of 70% alcohol. In beer there is only 5% alcohol. So you can understand how much, for a small child, little, just a sip of that sanitizer can be very, very detrimental. So be careful about that. Keep the surroundings clean, which is good for everybody, and promote fresh air circulation, so that the stale air, there is chance that the infection propagation will be more. And so open the windows when it is possible, have air filters if the area is very polluted, and also ensure that the air conditioner is on when you have packed the room totally. And promote respiratory etiquettes in children, like as we said, avoid touching the nose and mouth frequently. While coughing and sneezing, if they are covering their face with their hands, then they have to wash their hands immediately after the bout of cough and sneeze is over, and ensure that they are not coughing in front of, on the face of other people. So then comes the mask. So mask usage in small kids, it is not advisable, but after 5 to 6 years of age, they can properly use mask if they are trained to do it. So appropriate use of mask by adults is the most important thing, especially if they are suffering from viral infections like cold, cough, and fever is there. So, and they are looking after young kids, so to prevent the spread to them, because adults usually will be able to tackle the infection nicely in 1 or 2 days, they'll get better, but the children can suffer from this infection, the same infection, very dearly, and they can have prolonged illnesses, and sometimes they need hospitalization also. So appropriately use the mask, and ensure that whenever a family member has got these symptoms, they should be either staying away from the children, or they should wear mask if it is necessary for them to look after the kids while tending to the children. So children with allergies, they can also, when the cool breeze blows, it can trigger their allergies. So they can wear mask even when they don't have any symptoms. Just like, say they are going on school in the morning wind, and the child is sitting on in the front of the bike, which usually most of the kids do. They like that, but the air blast comes directly to them. So it's very important to ensure that the triggers are avoided, and this is a strong trigger for many kids. So ensure that they use the mask properly. And once the mask becomes wet, the filtration effect is gone. So wet masks are of no use. So dispose them of properly. All the masks after the use need to be disposed of properly. Then comes social physical distancing. Now in festival season, if it is possible to avoid crowded areas where there is too much of a crowd, or enclosed spaces in the crowded areas, better to avoid these areas, because especially if you have very small young kids at home or they are with you. So if you can do that, it is better, because the propagation of infection in these enclosed spaces is much higher. uh, and as we discussed, if a family member developed flu symptoms, ensure that that person maintains a distance from other young children and elderly members from the family, because both of these extremes of ages, they are very vulnerable for complication of these infections. And if a mother who is breastfeeding a baby, she gets affected with flu-like symptoms, she can still breastfeed the baby, because milk doesn't transmit the infection that much, but it's the close contact of the baby. So she has to ensure that she is practicing the SMS. She is wearing a proper mask properly, washing her hands when she is breastfeeding the child, and then once the feeding is over, other people can take care, look after the baby, and the 6 feet distance can be kept between the mother and the baby to further reduce the transmission of the infection, just like the way we used to do it in COVID times. Now, most important, which almost every parents who come to our OP asks us, how do boost the immunity of a child? My child keeps getting sick every now and then. So having trivial infections is a part and parcel of growing up. So we all acquired our immunity from various infections we got in our childhood, and that's how the body learned to tackle different viruses and bacteria. So as long as it is trivial, it is short lasting, and the child bounces back with their resilience quickly, then it's not a problem. But yes, how do you boost immunity? So there is no quick fix. I mean, people just want some pill or some syrup, and one particular food in the diet, and that should help them gaining the immunity. So there is nothing like that. So it is, you have to live a healthy lifestyle. It is an ongoing process. You can't simply have one stop solution for this. So one is healthy eating habits, regular physical activity, avoid sleep deprivation, and vaccination to with certain viruses and bacteria that will improve the immunity. So we'll go one by one. So first and foremost is healthy eating habits. Now, in the last few years, especially last post-COVID pandemic time, we have seen a very rapid surge in children having obesity. Because of the COVID pandemic, everything was restricted. Children were made to sit at home, and in front of the screen, they were attending their classes, and that greatly increased their sedentary habits, and they started munching food, and they started kind of adopting that lifestyle of a couch potato, where they were all the time sitting and eating and drinking things which are not to be encouraged. And there was hardly any physical activity, because they couldn't pursue their hobbies, they couldn't pursue their sports, and everywhere there were restrictions. But that era is now over, and we need to understand that we need to adapt to the proper healthy lifestyle. And so we need to ensure that our children, there is no distraction while eating. So the screen usage, mobile, TV, or any other screen usage while eating is strictly prohibited for all age groups, especially in young babies and children. Eating 5 types of fruits and vegetables increases the fiber intake and gives various minerals and vitamins, and it also is little filling, and it keeps the gut health also very good. So it's very important, and it is true for everybody, not only children. for all the family members, one can practice this. Family meals, having a family meal time, it greatly increases the social bonding, the family bonding. The children become fuss free, they eat everything because they see all other member having food, all the food items, and they're finishing their plate clean. So children also learn from this, and they also start enjoying it. And you can have simple chit chat while having it, and it increases the obviously increases the bonding. And it also avoids unhealthy feeding habits, avoids obesity. It is proven in that. And whenever nowadays there is a lot of fast food, lot of packaged food with gamut of advertisements everywhere on all platforms. So children are tempted to have all these packaged foods. So once they become old enough, just make them read the labels. Now government has made mandatory to for any packaged food to put what are the ingredients, what is the percentage of particular fat or unsaturated fat, saturated fat, trans fats. So what is the flour, wheat flour, or refined wheat flour, or whole wheat flour. So make them read this. So make them read this so that they understand that this what they are craving for is not something which is healthy, and it becomes an informed choice by the child to not have this particular food either repeatedly or even not touch it. So this practice, one, first parents have to do it. Ensure that whatever you are buying from a supermarket or from anything, you have to read the labels and see to it that there are not many hydrogenated vegetable fats or palm oil or various other coloring agents. So these are the things which are implicated in many lifestyle diseases and even cancers. So if you don't want your children to have this, first you have to learn to read the labels, and then go ahead and make your children also read the same. So any time whenever I'm giving any talk, the demand of the parents is what are the practical feeding tips. So these are the practical feeding tips we should be doing. What we have already, most of them we have covered. And this is something which you can encourage your children to have. And then comes the physical activity. So it is very very important. As I said, less physical activity, sedentary habits is leading to a lot of obesity in children. And for growing children, it is very important to channelize their energies so that they play a constructive role in the family, and as well as they learn a few things every now and then. So any form, whether it is running, jogging, swimming, or simple dancing, so any form is okay as long as it's a good physical activity which is happening regularly. And for this, again, parents have to be the role models. If parents are leading sedentary lives, they are not indulging in any routine physical activity, children will learn everything from their parents and grandparents and the family members. So they will see that okay, it is okay to be like this, and they will also follow the same now. But if the parents are making sure that they are indulging in something another, and letting the children also follow the steps, then it becomes a good family bonding time. So playing with them and teaching them some sport, again, greatly increases bonding. It also brings out the fighting spirit, the team spirit in the child. And also they learn to be disciplined in their various aspect of life. So it motivates them, and it motivates parents also to keep fit. So it's a win-win situation for both the children as well as the parents. Regular sunlight exposure is known to reduce myopia or short-sightedness. So children nowadays have so many specs and all. So myopic children, it has been seen, like in especially in Asian countries like China and Japan. They are making schools also in such a manner that every classroom has good sunlight, because it has shown to prevent or retard or slow down the short-sightedness in children. So that is important aspect. And again, vitamin D, which we get from naturally from the sunlight, which our skin makes, it helps in promoting bone growth, it helps in muscle growth, as well as maintaining the bones strength. So, and physical activity also promotes a sound sleep, which is very very important nowadays. Sleep deprivation is a major reason for children's behavior issues. So it reduces the screen time, it promotes sleep, which again in turn boosts your immunity. A sleep is must for a growing child, and it boosts the immune system of the child. And regular physical outdoor physical activity also boosts the immune system. So vaccination is again after the innate immunity, you can acquire the immunity. So either by getting the infection itself, which causes fever, which causes various other complications, or by having a part of virus which is killed, activated. Now everybody knows about vaccination, how they work because of the COVID vaccination. So vaccination, keep your child up to date as per the IEP schedule. The government schedule is a little restrictive in that various vaccine available diseases are not covered in those. But if you can afford to go to your pediatrician and take the vaccines for uncovered vaccines which are not in the UIP schedule or the universal immunization program of government, which is available free of cost, those which are not covered, you do get vaccinated. It is very very important because the child gets immunity against those particular diseases against which the virus or the vaccine is being taken. And it sometimes it may not prevent the infection, but it will definitely prevent the complications of those infections. So respiratory infections like flu, pneumonia, you do have vaccines against them. Water and foodborne infections like typhoid and jaundice, and even mosquito-borne infections like Japanese encephalitis. So these vaccines are available, and you can ask your pediatrician; they will guide you about it. Adults who are caring for children, especially young babies, infants, breastfeeding babies. So various vaccines are there, say like flu vaccine. We cannot give flu vaccine before 6 months of age. Then up to 6 months that child may not get protected. So how do you do that? So you form a cocoon of protected individuals around the child. So the 4-month old child is not going to go to office, so he's going to be surrounded by his family members. So if all the family members, they are protected by, they are vaccinated, you in turn are vaccinating the child till the time the child is able to attain the age where the child can have that particular vaccine. So this is known as cocoon effect of vaccination. So, and especially if there are elders in the family, say anybody who is more than 60 years and less than 5 years, these are the people who should have flu vaccines annually, because they extremes of ages, they are more vulnerable for the complications of flu. Those people who have some comorbidities where they are more vulnerable, they should also take, even if they don't belong to this age group. So again, vaccination is important in preventing these illnesses. It boosts your immune system as such in a generalized way as well. Now we'll quickly touch the mosquito-borne viral diseases. So dengue, chikungunya, and Japanese encephalitis, these are the ones and we all know about their complications, which what they can do, what havoc they can create, because many people might have suffered in this last couple of months. And the prevention is by prevention of the mosquito breeding as well as prevention of the mosquito bite. So these are the two aspects. So how do you prevent the breeding of mosquitoes? So say dengue, chikungunya, the Aedes mosquitoes, they breed in clean water. So avoid storage of clean water or avoid stagnation of clean water anywhere near your residence. So that much we can do. We can keep our surroundings clean and thereby help the nation as well. So, and you are the first beneficiary of that. So empty all the containers that hold water, such as cans and jars and drums and bottles and tires and pots. So ensure that they are free of this collected water. One can use larvae-eating fishes like guppy and gambusia in ornamental water tanks and gardens, and put lids on water cans used for storage. Use mosquito nets for individual protection on on beds and windows, and wear full clothing. Make sure that the children, when they are going to play in the evening, they wear full clothing, full pants, full leggings, and full sleeves shirts and t-shirts. and use mosquito repellents appropriately for the age. So these are the way we can prevent mosquito bites and also mosquito breeds. So then water and foodborne diseases, again, having clean water which is potable, which is drinkable, is very very important. So filter the water with a good filter, and if filtration is not possible, at least boil the water and then cool it and then use it for drinking and cooking purposes. Be vigilant regarding water quality, especially in monsoon seasons or after a heavy downpour, because many of the pipelines from which we get our water, they can get rusted and all, because they are there for the decades under the soil. So carry own water while traveling or in school, which is again very important, so that you don't have to worry about the water quality. And avoid eating at places where hygiene is not assured. In roadside eateries where you see that the hygiene is not being maintained, try to not have any pani puri or there or any other food item over there. So now we'll take the questions side by side, and thank you for your attention. I hope most of the things we have cleared. Now we'll go ahead with the questions. Should we start? Yes. So how long do viral infections usually last? Usual as up to 3 to 5 days is the viral infections effect lasts. So initially the symptoms will be more, and as the symptoms start, the child's immune system controls the viral infection. Usually after 3 to 5 days, it should start getting better. But when the fever stops or the fever subsides, you have to see to it that the child's activity, its oral intake, his overall general appearance is also improving. In certain diseases like say dengue, in half of the kids what we see is once the fever starts abating or starts subsiding, then they start having more symptoms. They become very weak, they are not able to retain anything orally, they keep puking, vomiting, and they have severe pains. And that is the time we call as critical phase or afebrile phase of the illness, where the child moves to second stage. So if once the fever is subsiding and the child is simultaneously getting better, that means the child has tackled the infection well and is now recovering. But somebody's fever is coming down but the child is not improving, that means this child is now going into something more sinister, and you need to quickly get your pediatrician or your doctor to see the child. So when attending large diet, I think we covered this. The question was asked early part in the talk. So if possible, if you can avoid it, or if it's a closed, especially if you know that it's a closed hall and it is not an open air, so the chances of infection propagation is more. So if anybody in your family has got flu-like symptoms, ensure that they don't attend these kind of gatherings, because they will be the ones who will propagate the infection. And if everybody does that, then it won't get propagated. But sometimes, even if all the precautions are taken, you can still get those infections. So try to be in that enclosed space for as less time as possible. If there is a open air area in the surrounding, you just get there. Once you have been to that particular for some days until there is so things like that you have to devise yourself. So we covered this. When should we seek medical attention? So whenever you see any kind of danger or warning signs, which we told, we have seen, so you have to seek medical attention. When you have viral infection, doing exercise basically will so because most of the viral infections, they will have you will have fibromyalgia or muscle pain, body ache, and if we on the top of it the muscle is all counterproductive most of the times. So if it is not okay for that. Otherwise, doing any significant exercise is something which we can avoid during the active infection. Once the person starts recovering, then gradually they can resume. Do not, okay, I was running 3 kilometers, so I will, once I recover, I will start straight away from 3 kilometers. No, you have to first judge yourself. So start with shorter distance and then keep going up as you know tolerate it better. So again, this one. So this basically, as I said, chikungunya outbreaks. Many part in our country has seen experienced these outbreaks in Telangana, in Maharashtra. There have been more, and this time the chikungunya complications also are more. Usually, it's just fever, rash, and a joint pain, and which lingers on for a while and it subsides. But nowadays we are seeing so a lot of chikungunya is going on, but again, thankfully, in the last 10 days, the number as well as the severity has come down. So tips and treatment options. Again, treatment options. There is no particular antiviral treatment for chikungunya as such, or even dengue. But again, hydration, keeping the fever at bay by using paracetamol. And if the pain is very severe, you can ask your doctor. They will prescribe some NSAIDs, but they have to be used very very sparingly because they have a lot of side effects. So, what are the recommended vaccination schedules? So, during festive season basically is post monsoon. So, flu is something in our country. The flu season starts from July and runs up to all the way up to March and April. So, we have flu vaccines. So, flu vaccine can be taken, and it can be taken by any age group after 6 months of age. But usually, what is recommended up to 6 years of age, and then after 60 years of age, annually you should take. Those people who are vulnerable, or as I said, those people who want to have a cocoon effect around their small babies, they can take these. Those who have comorbidities, they can also take these, because where your doctor recommends that you should take flu vaccine because you have this particular problem which can get aggravated, or it can aggravate your flu. So flu vaccine is one. Then in festive season, even though we say that we will be having food at hygienic places, so typhoid and hepatitis A, these are the two infections against which there is a vaccine. And typhoid, we all know that it affects a lot of countries. We are still having a lot of children currently also admitted with typhoid, which are culture proven, which are proven that they are typhoid. They're just not just viral test positive. They are culture proven typhoid cases, and it can also cause a lot of complication in children. So typhoid nowadays, effective vaccine, single dose. Earlier there used to be every 3 year you have to take. So that vaccine can be taken even by adults. So typhoid vaccine is something which one should take. Hepatitis A is another vaccine preventable viral jaundice disease. So it also gets by water and foodborne virus, so contaminated water or food if we eat. So first and foremost, try to avoid these kind of water or foods where you don't know the safety. You're not assured about the safety of that particular water or the food. So try to avoid that. And having vaccination will further increase the prevention rate. So these are the few vaccines where we can take these. And even Japanese encephalitis, now in a lot of districts of Telangana, government has run in school campaign has been run for Japanese encephalitis, because earlier it was only for a few endemic districts in our state, but now it is across all the districts. The government has run in this campaign. So that is again a mosquito-borne disease for which vaccine is available. Yes, whether same viral infection can one have more than once? Yes. So, like, I'll give you example of dengue. Dengue has got 4 different types, and if we get infected by one type, say dengue 1, we are still vulnerable for other 3, because they vary a lot amongst themselves, and each virus type will have different way of infecting us. So we can still get, so people do have dengue repeatedly, and once you have second or third dengue, it can actually cause more problem, because of the prior infection there are some infection enhancing antibodies produced in our immune system. So that can further enhance the problems with dengue. So it can happen not only in dengue, in influenza also, because influenza is a virus which is notorious. Why do we have every year a different vaccine? Because it keeps changing, it keeps changing its character, it keeps changing its ways to which immune system identifies it. So everybody wants to survive in this world, whether it's a virus, bacteria, or human beings or animals. So survival of fittest is going on, and viruses are there millions of years before us. They are there. They are the first viruses and bacteria, the microorganisms which we call. So they know how to survive. So they will keep changing. So they are smarter. So we have to also accordingly, we have to play the game, and that's why flu vaccine has to be taken every year, but not chickenpox or not say typhoid. So yes, you can have infection with the same virus again and again, because there are various types of those viruses. So if we say, like, uh, nowadays human papilloma virus is a virus which can cause cervical cancer in women and girls. So that vaccine has come up. So it has got 78 types. So there are various types, and you only have vaccine also for few types, or you get infection by one type but you are still vulnerable by other type. But yes, in most of the infection it happens that your severity of that infection won't be much. In dengue like infections, when you get the infection for second or third time, the severity can become much more. So that you have to be mindful of. So this one is, can you suggest any natural remedies to treat viral infections? As we almost spent few slides and almost 10 minutes, having a healthy lifestyle is the most important way of boosting your immunity and preventing these infections naturally. But it is not a quick fix in this era of fast food and ultra high speed internet. We want everything very quick, but that is not going to happen. We have to build our immunity by indulging in a healthy or practicing healthy lifestyle every day, and we have to inculcate this habit in our children also. So some people say not to eat particular fruit when you're suffering from cold, or during cold season. So basically, if somebody is allergic or sensitive, whenever you have that particular food or a fruit, you start having symptoms. So irrespective of whether you are already suffering or not, or whether it's summer or winter, you can still have it. Having said that, the main issue is what is the temperature of that particular food or fruit when you are having it. If it's refrigerated, if it is cold, likelihood is there that those who are allergic, those who are sensitive, because they are sensitive to cold temperature foods and cold temperature fruits, and if or cold temperature drinks, if they take it, they invariably get these things. So there is nothing like a particular fruit or food will increase the cold if you are already having cold. But if somebody is sensitive to it, they should definitely avoid it. Is it okay to allow kids to play in rain for some time? Yeah, it's okay as long as you afterwards they are drying themselves up and they are ensuring that they are not wet for a long period of time. Then it's okay. They can also enjoy the childhood which we enjoyed in our childhood. Can my child go to school if they have a mild fever, viral? Again, as we say, if it's a respiratory infection, chances of child transmitting the infection to other is more. So nowadays, many schools also don't want their children who are having fever to come. Exams and all also sometimes they will exempt them or they will take some re-exam. But prudent, because it's just not the infection risk to others, but the child himself can have very high grade fever, can have bouts of vomitings, can turn really sick in the school. So if it is possible to look after a child at home, that is the best way whenever a child is having fever. Why does my child get sick often even though they are healthy? So healthy, by healthy many people mean they are obese, so that again is a risk factor for getting infections more and for a prolonged period of time. But I'm assuming that you are saying healthy means they're growing well and they are not obese and not undernourished. uh, so as I said, it's a part and process of growing up, of gaining, because we get you encounter various viruses and bacteria, and the immune system gets affected by it and then finds a way to tackle it. And this time you get the fever, that particular time of getting infected, and then immune system trying to find a way to tackle it. So you will get symptoms. It can be trivial. If the immune system quickly gets a remedy, you will not get much symptoms. But if the immune system is taking time, you will get little more symptoms. That is the time where you need to give the medications or ensure that the hydration is well maintained and all. So it's a part and parcel of growing up. But somebody who is having very severe infections, needing hospitalization, or having a particular system affected time and again, then yes, you have to ensure that you take it to a pediatrician and you explain them in detail, give the proper history chronologically from where it all started, and that needs to be taken care of. But every seasonal infection, in the season there will be monthly or 2 monthly, because one child will have infection, they play with other kids, they will transmit it. By the time all the children in the class will have it, again some other infection comes up, and so this can go on. This time what we have seen is there were children with dengue, there were children with respiratory infections, there were children with typhoid and diarrhea and dysentery. So all the three groups which we discussed, they all came together. Usually, initial rainy season, active rainy season, we see mostly dengue and chikungunya, and as the rains subside and the winter starts, we tend to see more of flu-like illnesses. But this didn't happen this time. So this can happen, but if it is very severe every time, then yes, you need to ensure that your child is properly investigated by a doctor. Is it safe to give vaccine for a child with viral infections? No. When their active infection is there, the immune system is already occupied in fighting that disease. And most of the vaccines sometimes can cause fever in a child. So, already, if somebody is having fever and is fighting, so let the child recover. Let the child recover from that illness for a couple of weeks. Once the child is absolutely fine, then you can take this vaccine. Vaccination are for preventing the future infections. They are not to prevent the current ongoing infection. They can't. It doesn't act that way. I think we have covered most of it. Yeah, thank you very much for your time and for engaging with us. We'll be back with some other interesting topic which is related to your child's health. And till that time, take good care of yourself, and happy Navratri to everyone. Shiva Navratri. Namaste.